Exercise is the great fountain of youth. Exercise is the cure for diabetes, for hypertension, or obesity. But a prominent neurosurgeon doesn't think it's quite so easy. Welcome to ReachMD Book Club. I'm your host, Dr. John Russell. I'm joined today by Dr. Stephen Bearer, a prominent neurosurgeon, and his new book, Exercise Will Hurt You. Steve, welcome to the program.
Thank you.
So how did you get interested in this topic?
It stemmed from the fact that I am not a good exerciser. I am not disciplined, and I just really don't like doing it. And
that's a lot of work to write a book to get out exercise.
Well, over the years, exercising and playing sports, there's a lot in there about sports as well. I have hurt myself innumerable times. And so as I got older and tended to stretch and pull and hurt things more frequently, I decided I was going to just start to put my thoughts down on paper. I wrote an essay kind of for myself, justifying why I didn't like exercising and why it was not a great thing. And it just grew from there. And in short order, it became a book. I see a lot of head injuries as part of my practice. And over the last 6-8 years or so, concussions have mushroomed all over the news. And so that kind of came into it too. And then it just continued to expand.
So going back, you write about Mr. Paul Bragg.
Yes.
Who was he?
Paul Bragg was probably the founder or the father of the nutrition industry. And at the turn of the century, he came up with the idea of something called natural foods and created a story about himself that had to do a lot with the fact that he was always very youthful despite his advancing ages, and credited some of the natural foods that he created and then sold, marketed, and became wealthy doing it. Unfortunately, probably most of his story was false and fabricated, and he was probably a lot younger than he stated that he was, and so the fact that he looked young in his advanced age was because he really was younger. But that was the origins of the health food industry, and I talk a little bit about where did this all come from? Where did sports and exercise and the fact that it's such an integral part of our lifestyles, where did that come from? And that's Paul Bragg was one of the originators, not so much of exercise, but of health foods.
But so then he began Jack LaLanne and Charles Atlas.
Well, I think they came up simultaneously, more in parallel than in series. And Charles Atlas and Jack LaLanne were among the originators of exercise as a significant component of our lifestyles and how healthy it was for you. And I talk a lot to my generation. I'm a baby boomer, and my generation was really the first one to incorporate exercise as part of our lifestyles. My parents' generation didn't do that. They didn't really need to. Their lifestyle wasn't as mechanized and as easy as ours was. They needed to work more, and they were more physical just in their day-to-day routine. So as we developed this sense that exercise was essential and brought it into our everyday life, we forgot one thing. We got old. And now that we're in our 60s, we aren't in our 20s and 30s anymore. But some of us forgot to change our exercise style.
We think in our 20s.
Right. And so a lot of the book talks about that, about dealing with how your life changes, how your body changes, and listening to your body and dealing with the fact that you can't do it 50, what you could do at 20.
How big an industry is the sports and health industry?
It's billions of dollars.
How many billions do you think?
It's difficult to be sure. The number is hard to glean. I talk about it in the book, but it's in hundreds of billions of dollars a year. And it's not just sports. It's sports and exercise and the nutrition industry. I count that into it. And then there's all the peripherals. I mean, there's the clothing. There's the diet fads that kind of go along with this, and all the marketing, all the gadgets, especially nowadays with all the digital gadgets that we do. Now you can wear a watch that tells you how healthy you are, and it's never ending.
So I guess starting with talking about specific sports, how about just the simple overuse injuries? I go to the gym, I haven't been there for a while, and suddenly I'm aching on Monday.
Yeah, I spent some time talking about muscle injuries and tendon and ligamentous injuries, and I talk a little bit about the medicine of that and kind of the pathophysiology, what happens when you stretch a muscle or you tear a tendon. But those are so common to every exercise and to every sports. You could write a book that's 5,000 pages long just talking about that. And it would bore you to tears. So I'd talk a little bit about that in the beginning and then kind of say, well, that's not what this book is about. Yeah, that's out there, and you need to think about that. And that really is the thing that everybody has. That's why I say exercise will hurt you. I mean, if I am in a group of people and I say, do you exercise? They say, sure. Do you play sports? Yeah. Ever hurt yourself? Yeah. I mean, it's everybody.
So how about starting off with just the simple kind of runners, not the marathon runners, but just the simple runners. What have you found in your research or the problems with the day in and day out runner?
I think the biggest issue is injuries that don't seem like injuries and are small and minor, and then you ignore them, or you assume they're part of the sport, or they're part of the exercise, that you have to have this pain, that you have to have this thing going on that kind of nags and doesn't ever necessarily go away. Well, those are fairly minor things, and if you treat them appropriately and you rest and you get over them, you'll heal quickly and you'll be fine, and then you can go back. The problem is when you don't pay attention to that and you say, okay, yeah, it hurts, and then the next day it hurts a little more. And then ultimately, you've created a problem that's not so minor anymore. You could have a bigger problem. You know, a pulled muscle becomes a torn muscle. A stretched tendon becomes a torn tendon, and that sort of thing.
So I think one of the takeaway messages I got from the book is really people listening to their bodies.
Yeah.
You know, that if something hurts, it's probably not the right thing to be doing.
I talk about the adaptive nature of pain and how it helps you understand your environment, and that it's a signal that something's wrong and you ought to listen to it.
So I was shocked that you wrote that yoga is not kind of I thought yoga was kind of the perfect sport for people. But
well, I put yoga in because it's known as a healing sport or a healing endeavor. Yeah. And it is. I mean, yoga has many, many positive aspects, as does all of exercise and sport. And by the way, nowhere in the book do I say exercise isn't good for you.
Just on the title.
What I say is it will hurt you. It will hurt you. Some things that are good for you can hurt you.
Exactly.
But yoga, I talk about the fact that it has become so popular. And as the activity has grown and more people get into it, you have a lessening of the quality of the teachers. And that's a big deal. I mean, if you have a good teacher who knows you and knows some of your medical history, especially if you've had injuries or you have back problems or something like that, you'll be able to participate safely. But as yoga places have sprung up all over the place, I think that the quality of the teachers has suffered somewhat because of the rapidity of the expansion. And so people go into it and their teachers don't know them. And there's peer pressure. You know, the teacher says, do this, whatever this is. And you feel you have to do it because everyone around you is doing it. And the fact that it's causing searing pain in your back, you figure, well, that's part of this. I'll put up with
part of the healing.
Yes, exactly. But where I kind of go off a little bit on yoga is in some of the really bizarre kinds of stances, especially those that require significant bending of the neck and these odd postures that put a lot of pressure on the blood vessels that run through our neck up to our brain, how you can damage those. And there have been some instances of strokes participating in yoga. Now, it's not common. You know, this is not, if you go to a yoga place,
not 10%
they say, look to your left, look to your right,
yeah.
one of you is going to have a stroke. It's not that. Okay. So, yes, it's few and far between, but the purpose of the book really was to show you what's out there and show you what can happen and to kind of make you think. It's an attempt to put a caution on exercise. I describe it as informed consent for the exerciser. Okay. You know, as a surgeon, when I talk to someone about surgery, I've got to spend a lot of time talking about surgery, why I'm doing it, what can go wrong. But when I bought my $4,000 Trotter treadmill, no one told me how I could be hurt on it. So that's in there.
If you're just tuning in, you're listening to ReachMD Book Club. I'm your host, Dr. John Russell. I'm joined by Dr. Stephen Bearer with his new book, Exercise Will Hurt You. So certainly as a neurosurgeon, Probably concussions have become a big part of your practice over the last few years.
It has, and that's a big part of the book as well. That's the thing I see most commonly in my practice in terms of significant injuries, although I see a lot of spine problems too from people who have overdone it over the years. But concussions have become a huge problem. I'm the director of the concussion program at our hospital, Abington. And we see maybe 6, 8, 10 concussions a week, and they vary with the seasons. In the summer, it's more recreational kinds of things. During the school year, it's more scholastic sports injuries. But they have become outed, so to speak, as to the pernicious injuries that they can be. The days of the coach saying, run it off and run up and down the sidelines and putting it back in the game in a few plays are over, thankfully. Those were dangerous days. And I talk a little bit about that. And it's not just the scholastic level. The more you play and the further along you get, the more violent these sports become. And the whole NFL issue with concussions and long-term traumatic brain injuries and the NFL lawsuit, the players' suit against the NFL, I touch on that in there as well.
I was fascinated you wrote that in 1906 there were 19 college players who died playing football, and I guess Teddy Roosevelt saved collegiate football.
Yeah, I mean, it's a little counterintuitive because Teddy Roosevelt was known as being a sportsman and an adventurer and a hunter, and sports was a big deal in his life and in the life of his family. But the collegiate football injuries were becoming kind of intolerable, and he was instrumental in getting regulations and laws set, and out of that work came the NCAA, ultimately. And it was called something else in the beginning. I forget now what it was, but a few years after that organization developed, it then became the NC2A.
So chronic traumatic encephalopathy is kind of bandied about now with NFL and head injuries. Is this just something for professional athletes who've elected to be professional football players, or is this something for our collegiate athletes, our high school athletes?
Yeah, it's at all levels, although I have to caution you, chronic traumatic encephalopathy, or CTE, those very extensive changes in the brain that are seen long-term after multiple head injuries, the relationship between multiple injuries and chronic traumatic encephalopathy is pretty well set. But what that means, what chronic traumatic encephalopathy means to the individual, is still a little bit unknown. It's being blamed for the early dementia that we see in many of the professional athletes, in the suicides that have happened, not only in professional athletes. Junior Seau was one of them. He had chronic traumatic encephalopathy on autopsy. But there are a variety of college students who have committed suicide who are football players who didn't really have the same multiple head injury history that the professional athletes have. So, but there certainly is a growing body of suspicion, and ultimately I think will be linked, that multiple minor head injuries produce a serious set of events that lead to CTE that can cause dementia and depression and that sort of thing. So,
is this different than boxers?
No, boxing dementia has been around for a long time. It's called being punch drunk, and if you look at the boxing movies from the 30s and 40s, they talk about it. And there's always the guy at ringside who's kind of the guy who becomes the janitor because there's not much else he can do anymore. And we've seen that too. Muhammad Ali, his Parkinson's disease is probably head injury related. There is an entity called pugilistic Parkinson's disease. That's been, again, that's an old term that dates back 100 years. So there's been a long known association between boxing and severe brain malfunctions in relatively young people. If you look at most of the professional boxers, even who are alive today, many of them are demented.
So is the answer to football just better helmets?
No, because, well, it's part of it. I shouldn't say no. There's a whole variety of things that can be done. Probably rule changes are as important as any, and you're seeing that in scholastic football. They're trying to teach kids to keep their heads up. Don't put them down, don't headbutt, don't spear. Certainly in professional football, head-to-head, helmet-to-helmet contact has been outlawed, even though it probably happens 4 times a game at least. But by and large, it's accidental, but they're trying to get rid of that aspect of the contact. Better helmets, I think, will help, but I talk about the physics of head injury. And the problem is that you have to put the helmet on the brain, not on the head. You have to somehow cushion the brain inside the skull, and I'm not sure there's any way
that's
available just yet. I guess you could pump in some kind of foam into the brain cavity, but I don't think many people would volunteer for that. They've worked with helmet design. There are helmets out there that are experimental that have sensors in them that can measure the amount of force applied to the head in any given contact. That can be monitored on the sideline, and you can say that person took a dangerous hit, and even if they're not wobbling around out on the field, you might say that player should come out for a couple of plays. But that technology is exceedingly expensive, and very few people can afford it, and most places won't be able to use it. It's just too expensive. Maybe in the NFL, but even so, that's not going to prevent head injuries. The problem is if the head is moving through space and suddenly stops, the brain is going to rattle around inside the skull, and that's where the injury occurs. There's no way to prevent that other than to prevent the strike to the head.
So how about our marathoners and triathletes? Are they in a pickle too?
Well, not so much from head injury, unless they fall down a lot. But they certainly wear out their joints, their legs, and their knees, their hips. And I talk a little bit about ultra marathoners. I use an event in Scandinavia where they ski. It's a 2-day skiing event, and many of the people who train for that, who are long-term extreme athletes, many of them are showing evidence of hypertrophic heart disease. Their heart muscle gets too thick, and there's a point, I think, where aerobic exercise is good for your heart, and then you come over a hump on the graph and you start to go down in terms of its salutary effects, and it starts to negatively affect your heart. And I put in the book some research that's actually done in rats, where they're exercised and some of the changes that are seen in their hearts. So it may be that extreme exercise, in addition to the effect on the bones and the joints and your back and that sort of thing, can have some cardiovascular effects that are not necessarily that good for you.
So in finishing up and having all this research done, and you wrote exercise will hurt you, but I'm trying to advise my patients to lose weight and help their diabetes and hypertension. What would you recommend to a patient who doesn't want to kind of be coming into the doctor's hurt all the time, but really wants some of the better effects that they're going to get from exercise?
Well, I tell them that every time they get the urge to exercise, they should lie down until the urge goes away. And then they laugh a little bit, and then I tell them what I really do. And I think you should exercise as much as you want to exercise, but you should listen to your body. And if you are injured, or if you're having problems, if you're having pain, if something isn't right, deal with it. Don't let it go. Don't ignore it. Don't work your way through it. Don't exercise through it, because that'll probably make it worse. And get better. And then go back to doing whatever you want to do. And I don't have any problems with exercise. Like I said, nowhere do I say exercise isn't good for you. And I wish I could do it better. I wish I was more disciplined. I wish I enjoyed it. I don't like exercising. But I do it anyway, because I don't want to be too sedentary. And so I struggle through it. I'm not a maniacal exerciser. I have a rowing machine at home, and I put it on the TV, and I get in front of it and exercise until my muscles hurt. And I say, all right, I'm done.
So listen to your body, find something that you like. And Dr. Baer, thank you for being on the show.
My pleasure.
This is Dr. John Russell. For more information on this podcast or others in the series, please visit reachmd.com/book club. Thanks for listening.